Food insecurity is a serious problem affecting families across the country. Not being able to obtain nutritious and affordable foods without the assistance of free food programs ultimately affects people's health.
There's not food that's fresh and available within 5 to 10 miles, and it can be expensive to have healthy food, so it's easier to go through the drive-thru.
Acute problems such as hunger, anemia, and school attendance are some outcomes of food insecurity. But chronic diseases such as diabetes, obesity, hypertension, cardiovascular disease, and pediatric developmental delays are all made worse by the effects of food insecurity.
It comes down to, I've got to pay the rent, or I've got to have food, or I've got to have heat. So they buy things that are cheaper and fix it in a cheaper manner, which turns out to be fast food, fried foods, fatty foods that aren't beneficial to their health.
Community health centers, which provide primary care to millions of people across the country, are making a difference to the populations they serve. They're offering unique programs that help combat the problem of food deserts and food insecurity in their communities, programs that are innovative yet replicable, like Native Health in Phoenix, Arizona.
We serve anybody and everybody that comes through our doors. Primarily though, at this location, I would say most of the users are Native American. We know that our families don't have access to food, and so by partnering with a number of different programs and agencies, federally, state, and locally, we've been able to provide food and additional services to address the food insecurity issue.
Then you take a knife and you slice.
We developed something called Read It and Eat. It works with the Phoenix Public Library. The kids will come in, have a story read to them, and some kids' activities, and then we go into a cooking demonstration made with healthy food on a budget, and then they actually cook what the recipe is, and they take home a bag of produce as well as what they've cooked. For many of our families, the produce bags are the only produce that they get every week.
I come because it helps me financially. Sometimes buying groceries, it gets difficult, and I buy stuff that lasts longer. Sometimes fruit and vegetables don't last that long, so you just have to go with whatever in your budget.
It's so important because we eat healthy. We're eating more vegetables and fruits, making it more fun for her and me as well.
Let Perlinda know that she's getting a backpack today.
The backpack program we started a month ago, and the families get a bag of non-perishable items, so it could be pasta, beans, rice, tuna fish, peanut butter. It weighs 10 to 15 pounds, and they get a bag every week, and that will feed 4 people 3 meals on the weekend. We have 2 gardens. The community garden is open to the community, and a lot of our families have beds. And we have monthly educational programs like low desert gardening, healthy vegetables, and then we do harvesting with the families as well. And then the traditional garden was with Native Seed Search, and they provide seeds to families. And we planted a ½ acre of traditional plants. The kids actually got to go out in the field and pick the beans, the corns. There was one child that said to me that, oh, this is where you get corn, and this is what beans look like, and actually picking them off and eating them and tasting them and taking home a bag of produce from the garden. It's just been amazing, and it makes a huge difference.
In Greenville, we primarily serve low-income or the underserved population. We would recommend fresh fruits and vegetables, but it kind of just goes in one year and out the other because they don't have those resources available.
Antes del programa, pues comíamos lo que fuera, porque pues en veces no tiene uno, en veces sí.
The Food for Health program is a partnership with the North Texas Food Bank. On a weekly basis, the participants will come in. They will meet with a staff member from the North Texas Food Bank. Participants receive a recipe, a bag of produce, and also a kind of a box of shelf pantry type items to kind of build their kitchen. And there's also an incentive for showing up and getting that education and those resources.
It's really exciting when we're talking about how was everything last week? Did you make the recipes? And they light up and say, I did try the recipe and my kids loved it and it was so great. Or I opened the box and I loved all the incentives that we got. I had peanut butter, and just that pure excitement that I know that they're listening to what I'm saying and really implementing it into their life.
Stuff that they have gave us, we have never tried it. We've tried it and we like it.
My wife is learning all kinds of tips on fixing food for a diabetic. And then they give us the food that they talk about preparing.
I try to let the participants know that this all takes little steps.
After the 3-month time frame, participants will have a graduation ceremony, and they also are provided additional resources for local pantries in their area, the North Texas Food Bank, local farmers markets, kind of just a packet of information so that they can hopefully continue push it on into their normal everyday lives.
We're going to write you out an order for the pharmacy program.
The pharmacy program was created to help the people in eastern Kentucky by providing them fresh fruits and vegetables as a gateway, if you would, to better health. The doctors write out a prescription that says, okay, pharmacy, you would take that prescription to our program manager here in the clinic, and she would then compute how much that you're entitled to, $1 per day for each member in your family. You would then take the voucher to the farmer's market, and they would provide you with equivalent amount and wooden tokens, and then the patient would take that to the different vendors and spend it just like they would money.
With the pharmacy program, it's not just something that we are doing for them or to them, but that we're doing this with them. We need them to buy the vegetables, to eat the vegetables, be willing to try new recipes.
With the pharmacy program, what we're trying to do is break down the issue between how to get fresh fruits and vegetables, how to get fresh meats, fresh eggs, and then to utilize them and cook them in the right way to prepare them so they're not unhealthy and they help to be a resource in taking care of the patient's health.
Last February, my A1C was 14. Everything was out of whack.
Barry said, what can I do to do different to help control my blood sugar? We talked about diet and exercise, and we also introduced him to the pharmacy program.
It's taught me so much about what food can be. Fresh food. It comes straight from the garden into your hands. I've also learned to not fry so many foods too, and I got my A1C down to 6.2 in 6 months, from February to October. My cholesterol, it's perfect, and I credit the pharmacy program.
It shows that you can teach people to eat healthy, exercise regularly, and incorporate better, healthy lifestyles.
No matter what region of the country, combating the issue of food scarcity is an important role many community health centers play.
Reach out to those local resources and then just building those relationships and continued partnerships.
Patients are healthier, more engaged with the health center, and the communities as a whole become healthier together.
The patients are really enjoying this. It's changing their whole attitude toward health care.
Eat an apple. Tomato. Keep from eating candy, potato chips.
We've changed from the mode of acute care to more of preventive care, breaking down that barrier that diet and exercise are just as powerful as a pill or an injection in helping people to be healthier for longer periods of time.
We were worried, was it going to be messy? Was it going to be difficult? What's going to happen with food? It has been so simple, and our staff has been so awesome at working at this. Everybody pitches in and cleans up, but it takes very little staff time, no extra money. I mean, it has just been amazing, and partners come forward and want to help and want to get involved. This is what solves the problems. People coming together and working together.